Hello, I'm Dr. Robert Luce, a board-certified OBGYN physician with over 30 years of clinical experience. And we're going to review today Postpartum Day One instructions. This is just an overview of what to expect and what you should plan for the day after you deliver. Now, why am I bringing this up? Because I see my patients and I go over this after their delivery. But I'd like you, hopefully, to see this video before you deliver so you can make some plans and know what to anticipate. So one of the biggest take-home messages I want to communicate to you is getting rest, getting sleep. You're usually exhausted after having a baby, depends on what time you have the baby, but the next day, during the day, you're going to have visitors. Everybody wants to see the baby, everyone wants to text you, wants to communicate with you, wants to visit with you. You're super excited, you're having adrenaline, and usually your baby's kind of drowsy and sleepy and not feeding as much as you'd like. So you wake up the baby, you do a little feeding, but they're not really kicking in for feeding if you're doing breastfeeding or even bottle feeding. Now here's the thing that I want you to hear. Throughout the day, you're going to be largely awake if you're not careful. You're going to have all these visitors, and then come nighttime when it's time to go to sleep, that's when your baby's going to wake up and say, "Okay, Mom, I'm awake. I want some food." And so your baby will be up the whole night when all of your friends, all your visitors will be sleeping. So this is a well-established pattern. For whatever reason, babies are reversed and they're awake at night and usually sleep mostly during the day, especially the first day and the second day. So you need to focus in on taking some breaks and learn to take some naps. What I recommend is after you have a meal, each meal, take a nap, even if it's just a 15-minute nap. I recommend that you bring a mask so that the light, you can dim the light, and that way you sneak in a nap even if it's during the day. And you also talk to your friends and family and try to reserve some time, not necessarily have all the visitors all at once, and reserve some time and then send a message out and say, "Do not disturb," and say, "I'm taking a nap," and take that nap. It's really important to do. Hard to do, but usually most of my patients have a difficult time the first day. The second day, they're even more exhausted, and it happens again. So that's the most important, one of the most important things that I'm trying to communicate to you with this video. Now afterwards, they're going to give you routine instructions, like tell you what your hemoglobin level is, your blood level, to see how much you bled after having the baby, whether or not you need some iron pills, or whether or not it's enough that you might need a blood transfusion. Hopefully it's not, but they'll give you instructions. And generally around a hemoglobin, routine postpartum hemoglobin is around 10. You're usually around 11 or 12 beforehand. You get to about 10, hopefully 11 right after you deliver, but it might be 9. You start to feel it, feel a little weaker, a little more tired when it's below 9. And when you're below 7, that is when we start entertaining the thought about giving you a blood transfusion. Blood is very well screened, very low risk of HIV infection or hepatitis. All the years I've been doing this, I've never seen it happen, but your obstetrician will go over that with you if you're a candidate for that. Though if you are a little anemic, they're going to have you move around a little slower, get up slowly. When you get up in bed, sit on the edge of the bed before you stand up, because you might be dizzy from the exhaustion or from low blood pressure or a little dehydration. Make sure you drink lots of fluids. It is very common to not have a bowel movement the first day. Your belly's been filled with a baby, it's shrinking down, there's all kinds of room, and you might be getting some pain medicine that slows your bowels down. So it's very common to not have a bowel movement for 1, 2, or even 3 days after you deliver, even if you normally go once a day. So don't be alarmed by that. If you have a C-section, they usually will take off your dressing unless they have a sealant dressing that has a little waterproof absorber and a little antibiotic, and then they may leave that on. But they'll let you know whether you can take the dressing off, or they'll take it off, and whether or not you can get a shower, which is going to make you feel better. And then you're going to have a parade of nurses checking your vitals, checking, make sure you're okay, that you have adequate supplies, and then checking on the baby and doing different tests. So There's a lot of things happening. I want you to focus in on making sure you get some reserve time to get some rest. And also, there'll be lots of lessons and information for you to learn how to care for yourself immediately, how to care for the baby, and instructions for going home. So I hope this overview of the first day afterwards, after you deliver, what you found useful, and hopefully you've seen it before so you can plan a little bit and notify your family and friends to protect your time a little bit. Thank you.